Okay, the next section is postpartum contraception and immunizations. We'll go to contraception first. Lactation. Many patients will say, well, I don't need any birth control because I'm breastfeeding. And I've seen more than my share of patients who are breastfeeding, never have a menstrual period, and come back again pregnant. How long can you rely on lactation to keep a woman anovulatory? 3 months. Generally what we say is if she is not breastfeeding, 3 weeks. If she is breastfeeding, 3 months. Now some women will go for a year, 18 months, but you can't count on it. Diaphragm, when do you fit it? What we're looking here is to wait until the dimensions of the vagina and the perineum return back to their pre-pregnancy state. And generally we say 6 weeks. We will fit a diaphragm again at 6 weeks gestation. And that's just because we have a 6-week checkup. Intrauterine device, when do we place it? Again, just by common agreement, we will generally wait till 6 weeks and you have involution. Now I have physicians who I've talked to from Africa and other developing countries where they will put the IUD in immediately after delivery. And it can be successful. You have a high expulsion rate though, up to 20%. And we generally don't do that here in the United States. Estrogen plus progestin oral contraceptives. When do we start them? First thing you need to realize is estrogen is associated with thrombosis. And particularly after delivery, we have the increased coagulation factors from pregnancy. We have the stasis. We have the trauma to the vessels. So we typically don't want to start this until 3 weeks. Now, if she is breastfeeding, we want to avoid estrogen completely because estrogen can suppress lactation. But if she's not lactating, doesn't want to breastfeed, then we will start at 3 weeks. Progestins have no impact on thrombosis or coagulation. So those can be started immediately. And if a patient wants depomedroxyprogesterone acetate or Depo-Provera, we will give that to them, their first dose, in the hospital before they go home. Postpartum immunizations, we'll look at 2 of them. The first one is Rh immune globulin. We talked about this in the section on isoimmunization. If the mom is Rh negative and if the baby is Rh positive, then we will give the mother 300 micrograms of RhoGAM within 72 hours. What if she comes in a week later postpartum and says, I never got my RhoGAM? How long will it take before her lymphocytes get activated? Because if you give it after the lymphocytes are activated, it's going to be beside the point. The longer the period of time, the less likely it's going to be effective. A week, I would say, I might still give it, but after that, probably not. Rubella. As part of our prenatal laboratory tests, we assess to see if the mother has IgG antibodies and protection against rubella. If the mom is IgG negative, we will give active immunization of live attenuated rubella virus before she goes home from the hospital, and we instruct her to avoid pregnancy for 1 month because of the theoretical risk that she could infect the embryo if she should conceive within that period of time. And that is the end of postpartum contraception and immunizations.